What kind of a procedure would I benefit most from to eliminate the bags under my eyes? I'm a 42-year-old female with hereditary bags under my eyes that make me look tired and age me.
Thank you for your question. You're 42 years old and you submitted a single photo from the front and you're asking how to treat the puffy under eye bags. So certainly as a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years, specializing in cosmetic surgery, I can certainly share with you my approach as to how I evaluate a patient such as yourself. And I'll be able to give you some guidance. However, there is some limitation because I'm unable to do a proper physical examination. But I will give you some important ideas on how to prevent some problems that you could be at risk for looking at that single photo. So when we look at puffiness under the eyes, we're looking at whether or not there is fat under the eyes or puffy bags that are called herniated fat. Herniated fat means the fat pockets that's behind the eyelid pushes forward and creates a bulge. When that's the case, we address the fat pockets. What else do we look at? We'll also look at the skin quality. Skin quality has to do with the thinness of the skin, the fine lines and wrinkles, sun-related damage to the skin. We also look at potentially skin redundancy or skin excess. Is there more skin under the eyelid that even with the eyelid in the optimal position, there is still residual skin? And we also look at the support structures of the lower eyelid. The support structure of the lower eyelid is actually complex, and it's what makes lower eyelid surgery deceptively oversimplified, but it is actually quite complex. You see, the muscles under the eyelid, called the orbicularis muscle, acts as a hammock that holds the eyelid in place. That hammock is attached to the bone by something called the lateral canthal tendon. The reason I'm mentioning these things is that as a specialist, I see patients who come from all over the world whose eyelids are pulled down, and in many cases, the eyelids are actually everted out. And it's because there is a compromise in the stability of the lower eyelid from cosmetic surgery. So when we do an evaluation, we do something called a snap test, where we pull the eyelid down to see how well it snaps back. We look at all of these parameters, or I should say all of these specific factors, and then decide what the best approach is. So with that being said, from your photograph, I don't see a lot of what appears to be fat, but rather it looks like the skin is kind of draping and folding downward. Now, in the absence of physical examination, you may want to just pull your eyelid up a little bit, not too aggressively, but just a little bit to see if that improves the draping of the skin. If it does, then you may need some type of procedure called a lateral canthoplasty or lateral tarsal strip. These are procedures where the lower eyelid is reinforced in terms of its support, and unfortunately sometimes people think that that redundancy or appearance of redundancy means there's too much skin, and it ends up pulling the eyelid even further down. So that being said, you would also probably be a candidate for skin quality improvement. In our practice, we perform skin quality improvement in lighter skinned people with a combination of fractional CO2 laser. Fractional CO2 laser is the use of a laser which is a thermal device that ablates or removes the superficial layers of skin, as well as generates thermal energy into the dermis to contract the skin and tighten it up. Now, what we have found to be of real benefit in addition to the use of thermal energy is the application of regenerative medicine, which in the form of something called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it's a concentration of the growth factors that are beneficial for wound healing, as has been established in orthopedics and in oral surgery, and we're using it in our field in cosmetic surgery to help improve skin quality, improve the blood supply, and to make the skin healthier from underneath. So we kind of work on the skin from both sides. We work on it from the outside with the laser and from the inside with platelet-rich plasma, and we've been very, very excited about the quality of the results from this in conjunction to lower eyelid surgery. So again, to summarize, lower eyelid rejuvenation can include addressing of fat pockets, addressing of skin quality, addressing of excess skin, and addressing the structure of the lower eyelids. So with that being said, I'm going to suggest that you meet with qualified and experienced cosmetic surgeons who specialize in eyelid surgery. It is no secret that doctors who specialize tend to have more consistent results in focused areas than doctors who don't specialize. It's just important to be comfortable that you're going to get the best result possible from the word go, but at the same time there is an art to what we do. So looking at before and after pictures, meeting with the doctor, having the examination and feeling comfortable with this doctor's style and feeling comfortable in how the procedure is done. In our practice, for example, we do our procedures in our own Joint Commission approved facilities within our office, and we have dedicated staff that the patient gets to know really well from the time of their appointment to the time of their surgery and beyond, so they feel like more comfortable because they're not having the experience of meeting new people like at a hospital or a surgery center who they don't know, and all of that kind of combines together to make a good experience. We do the procedure under local anesthesia with light sedation, so also the recovery time is much faster, and most of our patients go back to work in 1 week. So all of these factors contribute to an optimal result in my experience and opinion. Being comfortable with the doctor, being comfortable with their technical expertise, being comfortable with the way the procedure is done, and the anesthesia and the aftercare. It all matters. So with that being said, I hope that was helpful. I wish you the best of luck, and thank you for your question.